Just so everyone knows, we are recording and this will be available on our YouTube channel. If you have not already subscribed, I highly recommend that you do. It's PFCC Partners YouTube channel, and you can find previous community of practice workshops, as well as some other great information and recordings that we've done throughout the years on applicable information. So for those who, I'm sure many of you are already familiar with PFCC Partners and who we are and what we do, but just in case you are new to us, welcome. Thank you for being here. We're happy to have you. But you can see here our mission, our vision, as well as our values. What we're all about. We're here to center the inclusive human experience of health. We want to transform that health experience into one that works with people and through communities as partners in their well-being. And one of the ways, so we know that healthcare is complex, the systems are difficult to navigate, and it's even more difficult to change. And with over 20 years of experience in working within this genre, looking to be able to pull together patients and their family members to make those changes. So PFCC Partners, we create a space with systems for patients and family caregivers to drive the improvement. And a way that, that we do that is through our PFA network. If you're not familiar with the PFA network, I encourage and invite you to check that out as well. The PFA network was created by patients and family members for patients and family members. And it's a space where it fills the space with impactful people, stories, and insights. And the way that's done is through, our community forums, making those connections with others, learning opportunities, our skills exchanges, as well as engagement opportunities. So that's a little bit about PFCC Partners and our PFA network. Again, I encourage you to check out our website to learn more. So without further ado, because I'm sure there will be tons of questions, if not from you all, from me, as we hear from Miguel Rentiera, who goes by Mike, as well as Albert Barty. Our topic is talking about eliminating barriers to patient and family partner participation and how the Los Angeles County Department of Health Services implemented a policy, and not only implemented, but was able to get it awarded a community compensation policy. So with that, I'm going to turn it over to Mike. It would help if I gave you sharing opportunity. Do you want to share your slides, or do you want me to advance them for you?
Naomi, my system's been giving me a little bit of problems this morning. So if you can advance them, that would be great, if that's okay.
Mm-hmm.
Awesome. Thank you so much.
Okay.
Awesome. We could go into the next one. Thank you so much, everyone. We really appreciate everybody's time. My name is Miguel Renteria. I go by Mike. I am the director of patient experience for the Los Angeles County Department of Health Services. And I'm joined today by Albert Barty, who is one of our patient family advisors from Rancho Los Amigos. And, I'll give him an opportunity to present himself as well. Albert?
Good afternoon, everyone. I'm Albert Barty III, out of Rancho Los Amigos, Downey. That's the Patient Family Advisory Council. I also work with the Rancho Research Institute, working with victims of violence, and also in the community with the Dad Project, which is developing accountable dads as a father engagement specialist. Nice to meet you all. And also familiar faces.
Thank you, Albert, for joining us. So a little bit about who we are. We are, again, the Los Angeles County Health Services. We are a model integrated health system. We are the second largest municipal health system in the nation. Our mission is to advance the health of our patients and our communities by providing extraordinary care. We operate 26 health centers and 4 acute care hospitals, in addition to providing health care to youth in the juvenile justice system and inmates in the LA County Jail. Across the network of health services, we directly operate clinic sites through partnerships with community-based clinics. And we care about 750,000 unique patients each year and employ over 23,000 workforce staff. Next slide, please, Naomi. Key takeaways today, really kind of share some awareness as to why we think this policy that we kind of put forth is important, and really kind of share, share an understanding of what the key patient-family engagement activity guidelines and applications are within the policy, and then kind of provide an overview of the policy key components. And we have Albert here today to share with us what his perspectives are and his viewpoints are in kind of participating, right, in terms of what the policy is, and kind of get Albert's perspective as well. Next slide, please. So why is this policy important? Our patient-family engagement work really comes from the lens that volunteerism is an opportunity that not everyone can afford. We recognize the invaluable contributions of people with lived experiences in shaping policies and programs that directly impact our communities. In line with our commitment to our equity, diversity, inclusion, and anti-racism work, we have developed a comprehensive compensation policy for our community members who collaborate on projects. Our aim is by providing compensation to our community members to share their lived experience will help us strengthen the diversity of our patient-family advisory community to better shape our services. Next slide, please. So wanted to kind of start a little bit with our story, kind of share with the team how we got to where we got and kind of where we're headed. What you see here is an image of our community. This is Los Angeles. Los Angeles County stretches from the high deserts of the Antelope Valley, crossing through our downtown cities, and ends up in the coast near our beaches. Our population is about 9.6 million people and covers about 4,000 square miles. Again, our health system consists of 4 hospitals and 26 health centers within 8 geographically located health center groups. And that they kind of range geographically across the LA County. We partnered with PFCCpartners in 2019. At that point, we only had 1 patient-family advisory council at Rancho Los Amigos, and they had been together for quite some time. But we quickly recognized that this was a patient-family engagement model that we wanted to scale to our other hospitals and our ambulatory care health center groups. At that point, 7 teams from across our health system participated in the PFCCpartners Gateways to PFAC Learning Collaborative. And in August of 2019, we had a capstone event in which we recognized each of the teams that participated in the collaborative. Once at that capstone, was so happy, we were like, go conquer the world and do everything you can to strengthen your patient-family advisory councils across the health system. Quickly, we began to recognize the challenges and difficulties of patient-family advisor continuous recruitment. Fast forward to the end of 2019, and half of those 7 teams began to have their first meetings with 2 or 3 patient-family advisors. I recall the joy that we had for each of the teams when they notified us that their first meeting was scheduled. And then in 2020 came, and we started the year with good momentum, and then came the great pause, right? The great pause that was everything and kind of everything shifting around COVID. We thrived and shifted to virtual meetings, established what we call our Patient Family Partnership Hub. Our Patient Family Partnership Hub is a community of DHS patients and family caregivers that meet in monthly conversation to discuss how we can improve our healthcare services. We look at our Patient Family Partnership Hub as a welcome all for patients and family caregivers to explore patient-family engagement opportunities. The difference, I mean, patients can join whenever they want and how they want. There are no applications or interviews in order to join our hub, in comparison to our patient-family advisory councils being more of a formal patient-family engagement structure. Through 2021, 2022, the challenges, again, of continuous patient-family advisory recruitment remained across the health system. In 2023, a group of patient-family engagement leaders really began the conversation of what a compensation policy would look like. Anna Gorman, who is our COO for our community programs, and her team really spearheaded this process for us, and really kind of opened up the door in really kind of beginning to establish this policy. We gained commitment for this work with Dr. Galley, who is our director of our LA County Health Services. She authored a letter to our Board of Supervisors, who are elected county officials that govern and lead the County of Los Angeles. We garnered their support and got approval for this initiative in late summer, early fall of last year. At that point, we began working with the Auditor Controller's Office and many attorneys from many departments across LA County in drafting our policy. The policy was finalized in early spring of this year. And then we began working with supply chain to identify a vendor that would be able to support this work. In May, we identified a vendor that had the capabilities to issue electronic gift cards, and we began the process of securing funds. And on June 13th, 2024, this past year, we issued our first stipend of $125 to our patient family advisors for participating in our Creating Connections Towards Equity community event. So I wanted to kind of share that to kind of level set, you know, what we want to share today, which is an overview of the policy and perspectives from Albert and everyone here as well. Next slide, please, Naomi. So really, you know, what we set up is, this is what we set up is our guidelines for understanding our PFE activities. The very first thing that we set up was, okay, how do we want to approach this? You know, what does compensation look like? We met with various folks from across the community, our patient family advisors, as well as from Libby and Lindsay, you know, various folks from different communities, I mean, from different community programs across the county, and we set up these guidelines. And this is just the start, right? In terms of surveys and interviews, you know, we're providing stipends of $25. In terms of listening sessions, focus groups, and meetings, we are providing for that activity $50. For panels, speeches, roundtables, and campaigns, they range from anywhere from $50 to $100. For participating in councils, advisory board meetings, governance board meetings, there is a range of anywhere between $50 to $150. And for participation in trainings and conferences, if it's a half day, the range is between $75 to $100. And for a full day, it's $100 to $150. This is kind of the start of what this program is looking like for us. Not to say that this is not dynamic and will change. I think we're always wanting to do and get better. But I think for the most part, this is kind of where we're starting in terms of what the guidelines look like, in terms of what the compensation looks like. Next slide, please, Naomi. The whole process starts with an application. This is what the application looks like. And I think this is an important kind of highlight, is that this application is open to all DHS workforce members, all 23,000 of us. We didn't want to kind of limit anyone across the system to pursue engagement activities with our patient family advisors, or even our or our community members. This is a part of the process to kind of get this started. It's an application that in which you kind of call out what the activity is, when it's going to be, kind of justification for the activity, the amount of gift cards that you need, the total funds that you will need. And then at that point, this application would then go to a designated lead for which we've identified from across the health system. Designated leads, we have them at our hospitals, at the central level, at the program level, and even at our health center group level to approve. And then at that point, that is basically it. That designated leads approves it, and then at that point you get authorized to give out those gift cards once you have that approved activity. Next slide, please, Naomi.
Mike, I see Nadine has a question. Are you open to taking a question now, or do you?
No, absolutely. Yes, I'm open to taking questions.
Thank you, Mike. Two quick questions, please. This compensation scale, is it per incident? Do you have a flat yearly rate? And my second question is, when you say attending fees rewarded for attending conferences, I'm assuming if there were any fees involved to go to these conferences, you would absorb that cost as well?
We would. Yes, absolutely. For attending conferences, fees that we would definitely absorb that cost. This would just be really just for your time at those conferences. In terms of maximum, so that we do have a maximum amount that we could issue to our community members, and that is not to exceed $600 per calendar year. And I think that is in alignment with different programs that the community members may otherwise be receiving. I think that is kind of where we've been recommended to kind of stay at. And not to say that we can go over that amount, but we just need finance approval to be able to do that.
Thank you.
Mm-hmm.
Barbara, I see your hand, and then Albert, I want to bring you in on this part too. So Barbara?
Yeah, hi, Mike.
Hi.
Two questions. One is, how did you come up with these amounts? I'm curious about the conversations around the amounts, both from the PFA perspective and also from the system perspective. And also, do you have a total budget for this? I'm also curious about that.
Yep. No, great questions. Great questions. I think we definitely leaned on Libby and Lindsay's knowledge in terms of what they were hearing at that point in time, kind of rewinding back to 2021, 2022, when we were first thinking about this, what works. I know there were other county departments that were also pursuing this space as well. You know, we engaged we have our equity, diversity, inclusion, and anti-racism committees across the health system. They also lent their insight and feedback into this policy. So there was a lot of conversations happening across the system. And I think this is kind of where we landed as a starting point. In terms of annual budget, so we've earmarked $250,000 for this compensation policy for per fiscal year. And that is, again, just the start. And what in terms of what we're looking at and how we're looking to support it.
Thank you.
Thank you for that. And Albert, I just want to pull you into the conversation, of course, because you were a part of it. So can you share what it was like for you to participate in this project and what that looked like from your perspective and how that is assisting or benefiting? I'm probably using the wrong word choice here.
Yeah, and maybe I could help clarify, Albert. Yeah,
Thank
just
you.
a little bit. I think at this point, since we're still talking about the policy, just really curious how, you know, as a patient family advisor and your connection with other patient family advisors in the community, like what's the impact that, you know, receiving compensation for your participation and, the advisory council at Rancho or other activities like the Creating Connections event, which we'll talk about in a little bit, but really just the impact that has on you and the benefit that you see it having on your community and other patient family advisors.
Both well explained and asked, but I did understand you, Naomi. I did hear you, and you clarified that much more clearer, Lindsay. But my impact so far has been it's been amazing. I've been very excited. I can't stop smiling because so many people have been interested in just me talking about it. But what actually happened was I found out that at first I was confused when I got into the meeting. I knew exactly what I would want to say and what the questions were and the things that were coming addressed of the reason. My confusion was, how did I get chosen? So now looking at this schedule here and looking at the importance of it and understanding and really listening to what the purpose and the goals are, I feel my place in there. I see where I'm put. But now what happened was it made everybody else want to do it too. So now they're asking, like this right here, they should be here right now to see this, because this is exactly how they can get involved. This I'm going to share it. I'm going to still share it. But this information right here is very much needed to get people to be able to do these type of things as well. What this did for me, at the same time, you don't have no direct day on when it comes. You don't know when your stipend is coming, but they give you perfect advice on how to be aware to avoid other things from stopping you from getting other income that you may be receiving. Very important to us. So also, which is Social Security mostly. In my case, it was Social Security. I got clarification on what to do and how to go about receiving this information and income. What I did with that income, it came at a time when I needed it randomly. I think it was just because I can be able to say this. What it did was it allowed me to pay for things that I needed to have done during times that I wasn't getting paid on my regular daily job. And that was very important to me because don't usually we just pray on those moments and then something happens like this out of nowhere. Something will gratefully just come by and bless you. So with all this experience, it's making others like my partners at Rancho and also other collab hospitals like Harbor UCLA, and even others outside. Like I went to Providence for a little medical issue, and I speak about these type of opportunities with other people to see if they have other programs as well, and they don't. So having this right here available is making other people know that they are important still, and there is possibility that you can still be compensated for things that may not seem as important, but when you really get to these groups, you really find out what the importance of the impact could be. And I think what I would also like to share about the last program, our last event, our last panel, I see the inclusion, and I keep having, I don't know if y'all remember, but we had this big old confetti cake on the wall, and I keep seeing us all. I see everybody in that cake, and everybody putting their input in, from tattoo faces to gang life to drug addiction abuse to spouse abuse to family abuse. All these type of things are important, and everybody is seeing their piece in this program, and it's amazing. So thank you so much for this opportunity, and I'm very looking forward to more. But I will also need information on how others are being chosen. As a question, my question would be, how can others feel important as well as I feel important? Even though I'm pursuing a degree, there's others with degrees that haven't had this opportunity that would love it.
Mm-hmm.
And I believe that this application would be able to allow them to do that without them having to feel judged about where they at or not included. That's the whole importance of it.
I think that's the beauty of the Patient Family Partnership Hub, is that anyone and anyone is welcome and included anytime. So we
Yes,
can definitely
anywhere.
share that information with you, Albert, to pass along. But I just wanted to reemphasize how you spoke about what some of you may have heard us at PFCC Partners talk about, the funfetti approach to patient family engagement, that funfetti cake. But I love how you described that, you're able to see everyone who was in that room at the Creating Connections event, which we'll talk about in a moment, in that cake, and that everyone is or has a piece of that cake. They're a slice. I really like that. Thank you, Albert. All right, I'll pass it back to our presenter.
Thank you. I see Pearlie, I'm not the presenter, but I see Pearlie has a question, and then if we can go on to Mike.
Mm-hmm.
This is to Mike. It's not a question, it's just a comment regarding the gift. since I became a recipient of that recent gift card for attending the event at Rancho. It was to me a surprise, a very pleasant experience, but I personally think that despite having none of that, the forums that we have attended so far are so inspiring and challenging and worth being part of. And even this desire to include more patients and family in this big goal of creating that inclusivity and equity and providing the best service. So I think that this is a very beautiful incentive that many more members of councils in respective hospitals should be aware of. And I think that would add to the enthusiasm, although personally, I said it was to me a surprise and I'm just happy for it. Thank you so much.
No, thank you, Pearl. And I appreciate everybody's, contribution. I think ultimately, we want to continue to create awareness. I think this is still new, in terms of it kind of just really kind of begin using or utilizing it in late August, early July. So really kind of beginning to have this process in place that you see here. Thank you, Naomi, for advancing the slide here, kind of getting us to here. The process has a lot of steps. There are a lot of moving parts to this, but I kind of wanted to just kind of share this high level overview of what it looks like. Step one is really the DHS workforce member, and that's anyone, submits the gift card application. I think when we were thinking about this is we didn't want to just reserve it for our patient family engagement champions. We really want to kind of be inclusive of everyone. And what I mean by everyone, I mean any one of our 23,000 workforce members has an opportunity to fill out this application and submit it to their designated leads for funding around these types of engagement activities. That guideline is set. It kind of provides framework and structure to what those activities could look like. But that's the very first step. Step two is the designated lead must approve or reject the application. And if approved, the amount, and if approved, authorize the amount to be provided for our community members. Step three is the designated lead works in distributing the gift cards to our DHS workforce members and enters this information in a log. Step four is the DHS workforce member then conducts the patient family engagement activity, records the agenda, sign-in sheet, and other supporting documentation. Step five is then the DHS workforce member issues the gift cards, logs this information, and as well as collects attestation forms. We do have an attestation form for our community members when receiving these gift cards. What they need to attest to is basically saying that they are not a family member of an employee for the County of Los Angeles. And then at that point, they are issued their card, and then we collect all that information and keep for our records for a minimum of 7 years. That's kind of high level. Obviously, there's a lot of details into these steps, but this is kind of really high level in terms of what this process looks like. And here, what you see here is really like Albert mentioned. Our first time that we used this card or this stipend was for a 2024 Creating Connections for Equity community event. Here, we really kind of started in terms of wanting to learn more of what our community thought around our equity, diversity, inclusion, and anti-racism work. This conversation started late last year when we were having one of our patient family engaged care think tanks. And one of our patient family engagement champions says, it's great that we're trying to increase the diversity of our councils. But how, as a facilitator, how do I know I'm doing the right job? How do I know I'm speaking the right way? And and then we were like, yeah, that's a great question. Let's explore that. And we got together with our director of equity, diversity, inclusion, and anti-racism, Danielle Gott, and got together with Libby and Lindsay and said, you know what, this is an opportunity for us to kind of begin to put let's invite more people to this conversation. And that day, we invited, what you see there on the bottom right is our community, our leaders, our patient family engagement champions, and everyone in between, and just really to have that conversation to see what that would look like. It was a great event, attended by a lot of folks. Even that day, we didn't turn anyone away. People were coming in through the doors, and we were like, yes, join us. We were bringing out tables from the back and bringing out chairs from the back, moving things around. But very thankful and grateful that it turned out to be really good, a really nice event. Is there another slide after this, Naomi, or is this one it? Oh, there we go. Okay. So yeah, so I think here is really, and I invite Albert to kind of come in and Lindsay to come in to share some perspective to tennis. And I think Pearl was there as well. So Pearl, I invite you to share your perspective as well.
If I could jump in, I really enjoyed this event because look you see how the tables are set up and the engagement. That's what I like. I mean, we know we work in the same field, but to be actually engaging with each other was very interesting. And I was able to go to 2 tables, so I felt special, But we talked to everybody, but we only had time limit to speak to so many. So we tried to arrange it. Well, what I experienced that they arranged it so that we could be able to communicate as quickly as possible, but as effective as possible, like just to make it happen. And also, we only had like about an hour or 2, I believe, and we did it. Like all that work to prepare for it took way longer than the event did. And it was very well worth it. And I felt the love. And as I started seeing more people come in, I was interested who they were because now I want to know what made them so interested. But I know why. But I want to know their purpose, their specific reason. So it was very exciting. And not to mention, we had food, y'all. It was great.
Too.
It was
It was
good.
great.
Yeah,
Thank
I
you so
thought,
much.
yeah, thanks, Albert and Mike. Linda, food is key. It brings people together. Food does. I completely agree. But I just commend LA County Health Services and Miguel and Albert, Pearlie, and just everyone who participated in the event because it really was kind of a launching point for us to really align patient family engagement and equity, diversity, inclusion, and anti-racism, and has really stemmed many additional conversations since then. We recently met with a health center who's looking to revamp their patient family engagement activities because, as Mike had described, over the past few years, some of the health centers have struggled with keeping patient family partners engaged in councils or other activities. And we had this opportunity in East LA to talk with their EDIA, Equity, Diversity, Inclusion, and Anti-Racism champions about patient family engagement so we can really start to align the two because we understand and we know that LA County Health Services understands that we can't get to a place of equitable healthcare without engaging people who are experiencing those disparities. So this event was just kind of the launching point of so many more discussions and activities and movement forward. So I was just really excited to be a part of it.
Awesome. If I can get to unmute myself. Mike, if it's okay with you, I see we have a few hands that are coming up, and we did get some questions that came in with registration. So would love to hear what some of the questions are. Nadine?
Yes, I actually had another question for Mike, but you can pose the one that I posted there. If you want to do that first.
Okay, sure. One of the questions that was asked, Mike, was would LA County be open to offering accreditations versus stipends?
Accreditations. Can you provide a little bit more context on that? What does that look like?
Oh, I was so hoping you wouldn't ask me. I don't know the acronym, but there is an maybe Libby or Lindsay know. There is an accreditation for like PFA type of individuals, more of a, not a clinician, more of a lay person. There are credentials for that. And if somebody's so, you have such great team members that are just live and breathe this and are willing to do it on a volunteer basis, an accreditation would go pretty far just to bolster their confidence and worth.
So
Got it. Okay. Oh, go ahead. I'm sorry.
No, if you don't mind if I jump in here. Hi, everybody, it's Libby, and my camera and my computer is saying I'm done and don't want to work anymore. So I apologize. But Nadine, it's a great question. It's actually one that the PFA network has struggled with for a while now. And so where we've landed with the guidance of our patient family partners advisory board is that accreditation can at times be a limiting factor. And what we really want to do is be even more inclusive. So that, you know, the idea of financial compensation can, as Albert referred to, break down barriers to participate. You know, if you're able to be in that meeting, then the financial compensation may help you to take care of the items that you would have otherwise been taking care of. So it is a great question, and one that I think we need to continue to think about. But the where we've landed with that is basically that accreditation builds in another sort of layer that might at times not support inclusion.
Sure, I get it, Libby. Thank you.
Uh-huh.
I was thinking more of seasoned individuals that, you know, you want to do something extra special, but where do you draw the line? I totally get what you're saying. And I'm talking fast because I want to get in my other question that I did not send. And that is, can you please clarify this group that you put together? Was it people off the street, or was it a subset of the 17 groups you currently have?
The group that we put together for our most
The
recent
community.
community event. Oh,
Yeah,
yes. So
Guess what?
yes, no, so that goes out to our patient family advisory community. So within the patient family partnership hub, we probably have about 100 plus individuals that we
Okay.
kind of connect to or send this information to, and then we share that out locally to our leads that are leading our patient family advisory councils at the local level. When I say local level, at the hospital and also at the health center group level. And send these invitations, these flyers to them, so they can create awareness, you know, within those local communities.
Great.
And then at that point, you know, we register them, and then they, you know, our patient families advisors are welcome to join. That day,
Great.
I think as we were having the event, though, others were really interested to see what we were doing and kept coming in, and we did not say no to anyone. As you saw
Great.
there, it was a full room.
Thanks for clarifying. And I'm going to table this other actually, I'll just put it in the chat.
Thanks, Nadine. Mary Jan, I see your hand.
Thanks, Naomi, and thanks, Mike, for sharing today. I just want to give your entire team kudos for putting this together. I think it's a fantastic opportunity for folks to be involved and to share their experiences. My question for you is related to the feedback loop. I'm wondering how at Health Services for the Los Angeles County, how do you demonstrate to patients that are participating in these events? So getting the compensation is great and it's one thing, but how do you demonstrate to them that what they're doing is making a difference in LA County?
Great question. You know, I think that in itself, I think it's with the structures that we have in place, right? We have monthly patient family partnership hub meetings. We share updates there, you know, to kind of give some context. So when we started this conversation and really kind of began kind of putting these pieces together for this community event back in June, we did it, and there was a lot of great momentum that came from it. Just this past week, we have a leadership development program that covered the same topics that were covered here at the community event. So I think that kind of is kind of working now in synergy and beginning to introduce some of these bodies of work, such our equity, diversity, inclusion, and anti-racism work, of what that looks like. I think there were folks there, leaders there that heard and now kind of took it and kind of evolved it and shared it with our community of supervisors, managers, and leaders. Just yesterday and Wednesday, they held that event. And I think we're now speaking or thinking about with Libby and Lindsay, okay, we got to reconnect again with Danielle, who's kind of leading this work globally for our health system, to kind of see what's next, right? It just wasn't a one-off thing. And I think, you know, we're just kind of continuing to take this a couple steps at a time. And when we get to that second step, 2 more appear, and then we take those 2. But I think that loop of communication is incredibly important, and we're very intentional, I think, when we're kind of take on these conversations.
Yeah, and if I could jump in on that too, Mike, I think you described that perfectly. And I think the feedback loop is, or we call it that communication loop. It's a lot easier when it's like a one-time project that you're working on, and you're engaging with patient family partners throughout that project so they can see kind of every step of the way how their perspectives are making a difference or changing the way old processes are improving. So I think that's a little bit easier to say, okay, this is our set timeline and the process we have. With the Creating Connections for Equity event, I think it's such a big, undertaking. And it's a culture change. And I think we've learned a lot, especially with quality improvement. These things take a lot of time. And sometimes as a patient family partner, we might not be able to see the impact that we're having on certain topics in our lifetime, or it may be 10 years from now and we're going to see that impact. I think Libby was just telling me about something from her son's hospital that they've just recently implemented, and that was years ago. So I think that's the other really important piece, is just setting expectations about the length of time that change takes in healthcare. And so I just wanted to bring that up because it can be challenging as a patient family partner to see the impact that you're having, even though you want to really, really bad.
Yeah.
And
And go ahead, Libby.
go ahead, Mike. Yep, you go.
Okay, no, thank you. Now, and I was just going to say, in terms of the community event, I think that was just the starting conversation.
Mhm.
That was just the start. I think we came away there with a sense of cultural humility that we're not. It's a never-ending process of learning every day about one's culture. It's like trying to get to a space that you're competent. It's like that's like a utopian space that I don't know if it exists, right? But I think kind of coming away with the humility that every day we learn more about each other, and every day we're trying to get a little bit better in what we do. And in our case, is shaping the services that we provide for our community.
Thanks so much, Mike. I was just going to jump in and jump back a little bit to the compensation policy. And for those of you on the line who don't know Mike, he's incredibly humble. So I'm going to spend a few minutes bragging on the process that Mike drove to get this compensation policy through Los Angeles County Board of Supervisors, which is just a huge entity with a lot of priorities. And so I think one message for all of our healthcare stakeholders on the call is just persistence. Working through the legal the legal departments, of which there seemed to be one popped up after another. It was a little bit like whack-a-mole there for a minute, but it's important for the organization to follow all of those processes, because that's where you get traction. And so now I think there was an earlier question about, is there an overall amount? Yes, that's funded by the LA County Board of Supervisors. So having a set aside budget to do this work and engage people from the community is a model I really want to see spread across the country. And Mike's perseverance overall and steadfast focus on what that policy could be and how it would impact the diversity that we could include in patient family partnership activities was just remarkable. There you go, Albert. If I could find emojis like that, I would do the same thing. But I think that is really has to be called out very strongly, that it takes persistence. But what happens when you persist through that is that it is now embedded in our municipal government. That's a huge win that gives such traction and sustainability to this program. So just really wanted to call that out. And Lindsay and I joked about the number of meetings we got on with Mike, and he was to give an update and say, well, we're still in process. I think we maybe have 100 times of Mike saying we're still in process. But he drove that process, along with his teammates, and certainly leadership support at LA County DHS. So just wanted to call that aspect out a little bit. And then, Mike, I know we have a couple minutes left, and
Mhm.
and we've just gotten a chance to roll out this process with the community connections. And so we've been learning a little bit, right, over the last couple of months or month or two about how we can clean up the process, how we can
Mhm.
move forward. I think that piece of continuous improvement is also important, especially at the outset of the policy implementation.
Absolutely, Libby. I think we are learning as we kind of send these gift cards out. There was a little hiccup with our vendor initially, but we sorted through that. I think it's just part of the growing pains and part of the of improvements that we're doing. And I think ultimately we want to continue to kind of shape this process as seamless as possible for our patient family advisory community and make this easy for all. And I see, Pearlie, you have your hand up, please.
Yeah, I just would not want to pass the opportunity of really congratulating Albert for what he did during that session recently at Rancho.
Mhm.
It was so inspiring, and you challenged us all. And for everyone, Mike, Lindsay, and everybody who put up that program. And in fact, my feedback for that session was I wish that could be echoed in specific local settings of hospitals and medical centers that would benefit from that kind of forum. On the other hand, I'd like to say also thank you for envisioning something that this incentive for members and everyone participating in this big crusade that we have. I'm asked, my question is, how will this be translated to specific hospital councils, advisory councils? How will this be? Because I felt so blessed by it. I mean, thankful for it. But I also wanted to know if this is available for the rest of the members of my group at LA Gen. So I'm sure this will also challenge them to be working together more, attending more regularly, maybe inspiring them to, in fact, invite others to participate. But speaking of our council at LA Gen, we felt that we did have some impact on some processes, protocols, and policies in the center because departments would present certain issues that they wanted us to be involved in, and they allowed us to give our inputs. And they would, after months, come back and say, yes, we did. We adopted your recommendations. So if that is, in fact, by itself an inspiration, to me, that is already an inspiration to be part of that group. But if the other members in my council would know that there's such a thing as compensation or at least a gift, I'm sure they will feel that that recognition is an affirmation of their volunteerism and maybe inspire more to be part of the group.
Yep. No, thank you, Pearlie. No, absolutely. So, we hear you loud and clear. I think the next steps in terms of, the creating connections towards equity is going to continue to take shape and get delivered at the hospital health center group level down the line. That's the vision. In terms of this policy being available, yes, it is available at LA General, at Harbor, at all of our health center groups. And it's just a matter of folks just completing those applications and taking them to their designated leads for approval. And then at that point, that resource becomes available. But this is really, we're like a few weeks in. So I think we're still in that awareness creation phase and understanding and learning phase. So I only anticipate this resource and program to continue to kind of strengthen as we continue to pick up on our activities.
Thank you.
So you
Thank
all
you,
have
Mike.
hit the ground running. Rosie, I see your hand. I want to ask this question that came in before as well. So one of the questions, Mike, is what factors should others consider, or what factors should we consider to determine fair compensation?
Yeah, great question, Naomi. I think it's a broader conversation, right? I think we kind of took those guidelines as a start, not to say that is a final document. I think as we continue to learn more, that those guidelines could definitely begin to kind of shape just like we've shaped this. But I think it's a start. We didn't want to let perfection kind of get in the way of progress, and we kind of just wanted to kind of just start, and that is kind of the approach that we've taken.
Oh, I love that. That's a great quote. Don't let perfection get in the way of progress.
Oh no, and that's all Livy there. That's Livy's. That's all Livy there. I won't take no credit for that. That's all Livy, and she's made me an adoptee of that saying and that quote as well.
Fabulous. Rosie, I see your hand.
Yeah, and I guess part of it is, Mike, thank you and Albert for being here today. I admire both of you, and you make my heart happy today. But I also want to challenge everybody on this call, on this chat today, to tell somebody or tell 10 people about what you heard here today, because the power of sharing this excitement is going to make this happen in other places. This is not just something that should be kept in LA. This should be in New York, and this should be in little Wisconsin, rural towns, and this should be everywhere. But if we don't tell people about the secrets we know and we believe in, then nothing happens. So I challenge all of you to tell somebody about what they did in LA, because if they can do it in LA, we probably could do it anywhere in this country. And, I just think tell 10 people, tell people who have the power to make it happen. It's just important, to tell people about it and not just keep it to yourself. And, that's how this is going to spread. This is not going to spread because Mike is out there telling everybody and Albert is out there telling everybody, but it's all of us saying, hey, I heard about something really great today, and this is what they're doing, and this is how they're doing it. And, it doesn't have to be perfect, but it needs to happen.
Love your thinking. Thank you for that call to action, Rosie. That when we knew, and the group working with Mike in LA County Department of Health Services in this coming about, we wanted to bring it to the community. So we do have it. We will have the recording, and so you can share the recording with others as well. Mike, there are a couple other questions, and Rosie, that is a great segue into one of the other questions that came in. Mike, what would be the starting point for this program for another healthcare system?
Great question. I think there is really getting your leadership's commitment. You need them. You're not going to be able to move this mountain without them. I think they set the stage, and we run with it, right? All I needed from our director was a board letter, and that it was just it was a formal letter requesting this program, these funds from our board of supervisors. At that point, we took over, met with their healthcare deputies, and just got it approved, and then worked with the lawyers, got it approved, work with our supply chains, got it approved. So it's just all we needed for our leadership is just to set the direction. And I think we, as patient family engagement champions, could run with it. And that's, I think, the first starting point. But you definitely need that leadership at the highest levels to kind of set that direction.
Awesome. Leadership and listening is something that I saw dropped into the chat. And the fact that you all did this in a year's time, to me, is unheard of. So that that is absolutely amazing. One other question that came in was, where do you meet members to offer education that yields good turnout? So I guess with the PFACs in different groups.
So we have our patient family advisory councils at hospitals and our ambulatory care health center groups. So geographically, we have 8 different health center groups, ranging from our high deserts to our coastal communities and everywhere in between. So there's opportunities to meet. We're now kind of shifting more into face-to-face meetings because it does bring back that extra layer of innovation sometimes and creativity that comes from being face-to-face, but we also meet virtually as well. So I think we try to meet our patient family advisors where they're at and see what they need and see what we could do to accommodate.
Thank you for that. And Albert, just to ask you one final question, what would you say to other patient and family partners that are out there but aren't yet connected?
Something I would say to them that hasn't connected as officially as they would like to, I would tell them to not give up. It's going to be challenges. It's going to be difficult. It's going to be painful. Not physically painful, but mentally, it's dragging. It's a lot of humbleness that you would need, like Mike has, that I'm learning from. A lot of reading, a lot of quotes like Libby has. I'm telling you, all these site things that we need is important for our community to understand how humble you need to be to handle these situations. So stay humble, stay consistent, stay aggressive, but be considerate of your health and others that we're actually trying to get to.
Wonderful. Mike, Albert, Pearlie, thank you all for the work that you're doing, that you continue to do, for sharing the progress that you all have made, the undertaking that you've taken, and the amazing work that you are continuing to do. So again, with that, Naomi and technology. It is the last Friday in August. Oh my gosh, can you believe it?
Already, huh?
We're going into the last quarter.
I'm scared to say 2025.
That's insane. Thank you all so much for spending an hour of your time with us on this Friday. Wishing you a great and safe weekend. You will receive the recording in a follow-up email. We look forward to seeing you next month. Take
Thank you
care.
so much.
Thank you.
May I
Everyone.
have the
Thank you.
permission to share this with my group at
Yes.
LAGen?
Absolutely.
We'll
Thank
be in
you
touch,
again,
Pearlie.
everybody.
Yeah.
Thank you,
Best
everybody, for
regards
y'all time.
and
Thank
looking
Yeah.
forward to
Thank you,
being part
Albert.
again of a
Thank you,
community
Albert.
program that
Thank
we
you,
will put up.
Pearlie.
Best
Thank
regards,
you.
you. A
congratulations,
great
Mike,
setup,
and
too.
thank you for
Thanks,
the
Mike.
effort.
and Albert.
Yeah.
No, thank
Appreciate
you.
it. Thank you.
Albert,
Great
yeah.
keep
job, you too.
inspiring.
Yeah.
Thank you so much.
We'll be in
I got my
touch. We'll
business.
talk to you
Miss
soon.
Libby, thank you.
Definitely.
Bye, all.
Our best regards to you all.
You
Thank
too.
you.
Bye, everybody.